All right, so let's talk about the elephant in the room. Free DSCSA from your reverse distributor. What are your thoughts?
So my initial thoughts are it's not actually free. Those are your credits that you can apply to other places within your business and other areas, and utilizing them on a DSCSA solution that won't make you fully compliant come November, I think is a big risk.
I agree. I also think it's not technically free. I mean, we hear, oh, it's free, but I mean, you're actually paying for it, right? I mean, first of all, these are your credits, so that's money that should be going back into your account, but instead they're applying it to something else. But I think there's more costs that are associated with this that health systems aren't thinking about.
Yeah.
If you're going with your reverse distributor for DSCSA, first of all, you have to understand they're a reverse distributor that has DSCSA, or they claim to, right? So they're missing some key functionalities.
Yeah.
And by missing those key functionalities, that's costing you money. Let's talk about VRS, Verification Router Service. If you don't have that, let's say you're a health system and you have 35 locations. You don't have Verification Router Service. So when you have a suspect product, you need to verify that product with the repackager or the manufacturer, right? Who's going to be doing that?
Yeah.
Are they going to rely on the pharmacist or the pharmacy tech? So as a health system, would you trust your pharmacy tech on your DSCSA, your FDA compliance? I mean, and who's going to be managing and monitoring that they're doing that verification process correct, right? So you have a pharmacy tech, they have a suspect product. Let's say they have a bottle and it looks like it's tampered with, the seal is broken, right? So you're a pharmacy tech, now you need to figure out, okay, who's the manufacturer? Who do I need to call at that manufacturer? I need to verify this. Now I need to also log all of these events, right? So DSCSA is all about the history. If you get audited, you need to have a history of that verification. So as a pharmacy tech, I need to spend now probably 30 minutes calling the manufacturer, trying to get a hold of someone if they're going to answer. Then I get a hold of them. I need to log in like a book. Okay, today's date, the time, my name, who's doing this verification, who am I calling? I need to log the product information and then the outcome of that. And so, that's going to take time. But now that I have one suspect product, I have to verify more products, right? Yeah. So now I've got to take other products of the same lots and verify those. So now as a pharmacy tech is, let's say they're taking 3 hours or more out of their day to try and verify this product. I mean, that costs money, right?
Yeah.
If you had verification router service, all you'd have to do is scan that 2D barcode and you'll get an instant, results. Is this authentic or not? And based on the outcome of that scan of that verification, our system will just automatically handle the next steps. We will automatically notify that manufacturer of the outcome of that scan, and we log that whole history. So what would take 3 hours manually without verification, with VRS, it takes
5 minutes.
5 minutes, I'd say 5 seconds.
Yeah.
You just scan that product, right?
Yep.
And especially if you have multiple products, you just scan those products and it's done. So, I don't think a lot of pharmacies or health systems think about that cost. Not only the cost, but the process and the SOPs. Now it's not only who's going to be doing it, but it's, do they know how to do it? And are they trained properly? That's a lot more work that goes into that, right?
Yeah, I mean, I think the biggest issue is the lack of visibility. So from a corporate level, like you said earlier, 30, 35 locations, even 10, 15 locations, you are fully reliant on your employee at each location to do this investigation, and you don't have any insight into what's going on during that process. So one of the big things with VRS, when your employees are scanning products, we're able to give you reports showing you this is the number of products that have been scanned this specific week. 90% of them came back as verified products. One of them came back as an illegitimate product, and then this is the process that was followed. So you'll get full insight into all of these product investigations at each individual location, allowing you to manage it from a corporate level. So I think that's one of the biggest things for me that worries me about utilizing a solution that doesn't have the verification router service.
I agree, and once you have that, once you have an illegitimate product, Now you have to fill out the 3911. Who's going to be doing that? Is the pharmacy tech going to do it? Is the pharmacist? And from a corporate level, how do you manage that, right? How do you ensure that all of these processes are being followed at all of your locations and have visibility into it? It's what you want to be able to know that it's actually happening. Right. If you're at a corporate office and you have 35 locations, you'd probably want to know if you've got suspect products, right? You probably want to have that visibility. So that's a cost. That's a business cost that isn't being talked about that should be. And then once you have that illegitimate product, it's going to take additional time to fill out that 3911 and submit it.
Yeah.
And do they know how? Have they ever done that before? Do they know where to go? With LSPedia, if you have a suspect product, you simply scan that product and we will pre-populate that entire 3911. Yeah. You hit send and it's done. And the records are there. And from a corporate standpoint, they can see all of their locations, not only where did they have these suspect or illegitimate products, was it taken care of properly? Was the 3911 filled out and sent, right? And that's key.
Yeah.
You want to ensure that your stores, your locations are all doing this right. So let's talk about exceptions.
Yeah. That's the big elephant in the room.
What does exceptions look like right? What is the rate of exception in error right now?
Yeah, so right now what we're seeing industry-wide between wholesalers, pharmacies, manufacturers to wholesalers is right around 10%. So from a pharmacy perspective, what that means is 1 out of every 10 shipments that you're receiving, you're going to have to quarantine because of a data error from your supplier, right? And that has to be managed at the individual location receiving the product. So again, if you don't have a tool or a system in place that can manage exceptions for you, you're going to have to handle that yourself manually. So that means whoever's receiving the product is calling your wholesaler.
Pharmacy tech.
Yeah, and going through that investigation and trying to figure out what's wrong with the file. With LSPedia, we have Investigator. We're the only solution provider that has access to this tool, and we automate that exception process. So if a file comes in with bad data, we're sending that directly back to your supplier. We're giving them a way to fix that issue and get it directly back into your system. So all of that is being managed automatically for you. And that's just one side, right? That's just a data issue. There's also product, no data exceptions that can arise too once you get the product in possession.
I mean, I agree, but if you don't have an exceptions management tool built in, if you're trusting your reverse distributor who's saying they have DSCSA, they don't have exceptions, how would you even know? You're a pharmacist or a pharmacy tech, how are you going to know that there's a data error in that file? You wouldn't.
Yeah.
So what is that risk? Now you're accepting products, or worse, dispensing a product that could be, let's say it could be illegitimate, right? Or it could be fine, but you don't have the right data for it. And you shouldn't have accepted that product. You shouldn't have dispensed it. It should have been quarantined until you had the right data for it, right? So if you don't have exceptions, not only can you not handle it, but you don't even know that you have an exception, right? And if you do have an exception like product no data, right, or data no product, how is that going to be resolved? Again, is the pharmacist or pharmacy tech going to just spend time calling the supplier and explaining that? It could have already been resolved. Right? So that's another cost that's not being thought about. What about trading partner licenses and verifications?
Yeah, I mean that's a big one. Right now, one of the biggest requirements that's currently in place is making sure that everybody you're doing business with is currently a trading partner that has all of their licenses valid and up to date. And so some of these solutions, like your reverse distribution solutions, they don't have access to a module that will manage that for you, right? They're not integrated with MedPro or NABP Pulse programs that will validate licenses upon ordering. So that leaves you open to any issues. If you have to place an order with a smaller supplier, so a smaller wholesaler or a smaller manufacturer, you're leaving yourself at risk because you have to do that manual investigation. You have to get their licenses. You have to store them on your own versus choosing a solution that will manage that whole process for you and validate the whole thing.
So if you don't have a solution that stores, manages, and validates your trading partner licenses, again, something else your pharmacists or techs are going to have to do. So that's another layer of the SOP and more training they're going to have to do. And do you want to rely on them to make sure you're compliant? Probably not. All right, so what about connections? We've been doing this for over 8 years. We have over 150,000 AS2 connections. AS2 connections for EPCIS, right? That's different than an EDI connection for lot level ASN. So we hear it all the time. We're talking with pharmacies, with health systems, and they say, oh, we're good, we're getting data. Are you really?
Yeah.
That's funny. And once we educate them that there is a difference between an AS2 connection for EPCIS versus the old lot level ASN, they realize, oh yeah, I don't have any data. In fact, I don't have any connections. Yeah. And when they reach out to their reverse distributor who's providing this service to them, their responses are, we're working on them, right? If you're not connected today, you're behind. You're non-compliant. If your provider isn't connected already today, you're in a whirlwind, right? I mean, we're 7 months away, and it's taken us 8 years to make all these connections. There's no way that they're going to be able to establish all these connections in time, right? So would you rely on a solution that doesn't have these connections, that isn't receiving EPCIS data?
Yeah, no.
I mean, what are you going to do?
No. You're going to be in for a world of trouble. I mean, that's the biggest thing I hear day to day, like you mentioned, is everybody thinks they're good to go, and they just don't understand there's a difference between the ASN that they're getting right now from their provider and EPCIS. So, one of the biggest things that they don't understand is that everything's switching over to EPCIS in November. So all of that other stuff is sunsetting. So if you're not receiving serialization data from your supplier by November, you're not going to be able to receive products and then distribute them to the people coming to your different pharmacies or hospitals. And so that's one thing that you really need to make sure is that your provider is able to establish EPCIS connections and then show you those EPCIS connections and show you how they receive products against serialized data. There's a lot of providers out there right now that are showing lot level data where they're scanning, an ASN file, and they're doing the receiving through that, but that's completely different from EPCIS.
So what do you do if you ask your provider and say, show it to me, can you show me a demo? And they say, hey, I can't show you a demo right now, I need a few months. Maybe I can show you a demo by the end of summer.
Yeah, that's concerning. So that's
terrifying.
That's one thing that I've heard on a lot of different calls when they're reaching out to their reverse distributor who does DSCSA, and they'd like to see what the EPCIS functionality looks like, what these connections look like.
I want to see a live demo.
Yeah, live demo. And what they're getting told is, hey, we'll show you at the end of summer or potentially the beginning of fall.
We're in a stabilization period right now. Yeah. You're supposed to not only have your system set up, but be practicing. Yeah. And if your provider isn't ready for it yet, that's a red flag. Would you risk your hospital? Would you risk your pharmacy on a solution that's not there yet?
No. And one thing you have to remember is there's a lot of requirements that we talked about today, but before any of that happens, everything starts with connections with your suppliers. Yeah. That is the forefront of DSCSAs. You have to get connected with them. You have to receive that serialized data. So if you can't do that already, then you're in big trouble, because nothing else matters if you're not able to receive an EPCIS file from your supplier and then potentially be able to receive your products against that, whether that's scanning the individual 2D barcode or scanning the tote or visually inspecting every product. If you're not getting that data, none of the other requirements matter, because you're not going to be able to receive the products and dispense them come November anyways.
For sure. And we all know scanning against EPCIS, that's a capability it took us years to do. Mm-hmm. So interesting. So is it really free?
No. I would
You're
say
going to be spending a lot more money on labor costs and dealing with, issues, compliance risks.
That's the biggest thing.
It's not free. There's nothing that's free.
Yeah.
Anything that's free is if it's too good to be true, it is.
Yeah. I mean, you have other areas of your business that you can apply those credits to, but if you choose to apply
or
those,
you could just get those credits back and put them towards a real DSCSA solution that has you covered.
Yeah, absolutely.
Okay, so a health system wants to switch from the reverse distributor to a DSCSA provider like LSPedia. How long does it take for us to get them?
I would say we can get them fully onboarded, connected with their trading partners in under 30 days, right? So that's typically what we're looking at. So when we take a health system from another solution provider, we bring them into LSPedia, we start the onboarding process. you'll start receiving data, you'll start your training, you'll start being able to scan products all within 30 days. And I think one key feature that we didn't mention earlier that is involved or that happens during the implementation process is integrations. So a lot of these other providers aren't going to integrate with the software that you're using.
They're,
so if you're using
they're hospital
Epic,
systems.
Right. Yeah. So that's a big deal.
And especially if integrations is everything. This is all about making lives easier for your staff, your pharmacists, your techs, not making more difficult. Well, we're integrated. We are integrated with their pharmacy management systems, their central pharmacy systems, their EHR, their health systems. So we receive the data and we push it right to their system. Or with some of our partners, our hospital systems, they receive inside of that hospital system and ping us on the back end. So if you don't have that, that's another issue. Now you're going to have to deal with multiple scans. So if you're relying on your reverse distributor and their DSCSA or so-called solution, you're going to have to receive in that solution and then scan 3 or 4 times into other systems, right?
Yeah.
So that takes more time, more money. So you're losing money everywhere you look.
Yeah, that's a big thing. So all of that happens during our implementation process. You get your own project manager, and we'll work through those integrations with you. And I think that's a big thing is every health system you talk with, the biggest thing that they don't want to do is spend the time scanning in 3 or 4 systems, right? And so that's why OneScan was developed. I mean, it's in the name. So we'll do those integrations. You scan in our system, we'll push the data, or in some cases, you can scan in the platform that you're already using, and we'll do all of the DSCSA work through that integration and make sure that the products are fine that you're receiving.
And then on top of DSCSA, LSPedia does recall management, suspect order monitoring, drug shortage intelligence. I mean, it's a no-brainer, right?
Absolutely.